It has sorry.
Oh, well, okay, hold on. We can do this again.
Take two.
One never knows. Turn your face this way, young lady.
Terry. Hola.
Hello. Okay, all right.
Okay.
Going.
Okay, so thanks everybody for being here. I'm talking today about fasting meals. So, nothing to eat or drink after midnight the night before. Maybe some of you have had those done, or have had to tell your patients to come in and have those done. Or maybe you've had to even take the blood from those fasting patients. So, why is that so important? So, around the world, all practitioners and providers ask the patients to come in fasting because of one main reason: the LDL cholesterol. It's the low-density lipoprotein. So by looking at those results from a fasting panel and the coronary heart disease risk factors, we can prevent coronary heart disease in our patients. So the adult treatment panel is the one that gives us the guidelines as to how to look at those results and at those risk factors. And that way we can choose if we're going to do lifestyle changes or we're going to start drug therapy. So the LDL cholesterol is the primary target of the therapy, and this is because the research in hypercholesterolemia shows that it is directly related. So high LDL is directly related to risk of cardiovascular heart disease. And it's also shown through research that an LDL lowering therapy causes the coronary heart disease to go down, the risk. And the risk assessment requires measuring this LDL cholesterol and also identify any accompanying risk factors for coronary heart disease. Adults over 20 years old are supposed to have a lipid panel every 5 years. And on the screen here, what I'm showing is the LDL cholesterol, total cholesterol, and the HDL cholesterol values and what they mean. So the most important thing that I want you to remember today is that an LDL under 100 is considered optimal. Then after looking at those results, like I said, we have to look at what the patient, or like what other risk factors we have as patients. So one of the risk factors that is mainly known by everybody is the smoking, cigarette smoking. Hypertension is another one. Having a low HDL, which is another type of cholesterol, the high density cholesterol. And then any family history of premature coronary heart disease. And on the other hand, we'll have an HDL cholesterol, so the good cholesterol that is high is considered a negative risk factor, we can put it that way. Then once we look at that, we can assess the LDL in a different way. So we're going to talk about risk categories. And then we look if we have one or two or more of the cardiovascular heart disease risk, like I mentioned, like hypertension, the smoking, low HDL, and family history of coronary heart disease. And then once we look at those things, then we're going to go into either primary prevention or secondary prevention. And then the primary prevention is changes in lifestyle, and that includes don't eat saturated fats, or lower your intake of saturated fat, increase your physical activity, and work on weight control, of course. And then after that, we're going to look at secondary prevention, and that's when we think about drug therapy. But before starting drug therapy, we always have to make sure that there's no secondary hyperlipidemia, so we have to discard other diseases like diabetes that could make cholesterol go up. And once we discard those, or even genetic predisposition or other diseases, once we discard those, then it's when we think about starting drug therapy. And then I know all this information might seem overwhelming. So, in like few words, I want to say, first, evaluate the fasting LDL results. Then look at those results along with cardiovascular heart disease risk, and then start primary prevention, and then make sure that there's no other conditions, and then start thinking about drug therapy. And so we can get our main goal, which is prevent coronary heart disease. And so everyone, this is the reason why we have those fasting labs done, or take the blood from those patients that have been fasting, having nothing to eat or drink after midnight the night before. Thank you.
Now I have to show everybody again, right?
Yes. Please. And I didn't get you bored.
Yeah, we did. Yeah, we didn't leave you.
So I don't want to.
Very good.
Yay!